Question of the day. Brian, what do you say to people that say that any benefits from hypnotherapy are nothing more than a placebo effect? Well, the first thing that I say is, you say that like it's a bad thing. Let's look at the concern and see if we can determine exactly what the charge really is. I asked my friend Google what a placebo was and found pages and pages of definitions, a couple of which I think will bracket this issue so we can address that. The first full definition of placebo came from Merriam-Webster's dictionary, and it says, 1A, a usually pharmacologically inert preparation prepared and prescribed more for the mental relief of the patient than for its actual effect on a disorder. B, it's an inert or innocuous substance used especially in controlled experiments testing the efficacy of another substance, such as a drug. Definition number 2 is something tending to soothe. Okay. So the first definition implies that a mental relief is not an actual relief, but of course, this begs the question of what is the criteria for relief? If I no longer feel pain or if I no longer crave cigarettes or overeat, is this not an improvement? And doesn't definition 2 contradict definition number 1? So let's assume that relief following hypnotherapy exists. Because if it didn't, the statement wouldn't be, is it a placebo effect? The statement would be, Brian, hypnosis doesn't work. So let's look at a medical dictionary to see if that might not be helpful. Now, this is a little involved, and I question whether I should actually read the entire thing, but I think it's important. This comes from the Miller-Keene Encyclopedia and Dictionary of Medicine, Nursing, and Allied Health, 7th edition. A supposedly inert substance, such as a sugar pill or injection of sterile water, given under the guise of effective treatment. Paradoxically, it may exert either a positive or a negative effect on the recipient. See placebo effect. A positive placebo effect can occur when caregiver and patient believe and expect a medication or procedure to relieve symptoms. Placebos are sometimes used in controlled clinical trials of new drugs, while some patients selected at random are given the new drug and others are given a placebo. It may be an active placebo that mimics the new drug's side effects. The patients taking the new drug must have significantly more relief of symptoms than the control group taking the placebo for the new drug to be considered to be effective. See also single-blind, double-blind, and triple-blind studies. Number 2, the term has been extended to mean virtually any type of ineffective treatment. Interesting, those are my words, interesting, including surgery and psychotherapy. Use of placebos is ethically problematic because it deceives the patients. Ethical questions regarding the use of placebos include 1. Is deception necessary to produce the benefit? And 2. Do placebos have a non-deceptive use? Lots of studies to both of those, and we can go into those at other times. Okay, now these definitions tend to talk in circles too. Let's see about one more medical definition and see if we can bracket that issue. This one comes from the American Heritage Medical Dictionary, copyrighted 2007 by Houghton Mifflin Company. Their definition is a substance that has a positive effects as a result of a patient's perception that it is beneficial rather than as a result of a causative ingredient. Interesting, the causative ingredient statement there. B says an inactive substance or preparation used as a control, an experiment, or test to determine the effectiveness of a medicine. So, I like the simplicity of this one. And so let's see if we can kind of narrow down this issue. It appears that there's concern that modalities such as hypnotherapy, or as one of these mentioned, surgery and psychotherapy, bring about resolution to disease or discomfort or dilemma by fake or unreal processes. Does that sound accusatorial enough? It's like saying that the relief that you feel isn't real, so therefore you're crazy or mentally weak. I think that's probably the part that gets most folks, is they don't want to be thought to be crazy or mentally weak. Let's look at a few classic, medically well-documented cases and see if we can further narrow down this question. A famous case involving thoracic surgery used a randomized trial of internal mammary artery ligation versus a sham operation for angina pectoris way back in 1959. The placebo response mimics that seen for other therapeutic interventions, which means that the patients all achieved relief from their chest pain at the same rate for either surgery. In other words, the medically accepted treatment at the time of internal mammary artery ligation, the tying off of an artery, trying to stimulate the body's development of alternative vascularity in an effort to create a sort of natural bypass. It had the same success rate, over 80%, as a sham procedure whereby the surgeons opened up the chest cavity and closed it back up without actually doing anything other than making a bad scar. So my phrase, an 80% success rate for a surgery that had zero medical or physiological possibilities of actually relieving symptoms. A little scary, isn't it? So one question may be, if you could gain relief from your symptoms to the exact same degree, if not better, without having your chest cracked open, would you do it? Another question, both surgeries were conducted to relieve chest pain or angina, and both successfully did so with equal efficacy. So, a part of this would be one of these surgeries is medically, or at least was medically accepted, and one is not. Neither provided an actual medical, physiological, beneficial change to the patient. Both produced the same results. Another thought, are the results more real for the medically accepted treatment than for the sham? And the third thought that I have is, based on what you know now, would you consider both types of these surgeries to be sham procedures? Surely, you may say, this is an isolated incident. It was 1959 after all. Well, in the field of orthopedics, Mosley and others in 2002 evaluated the effectiveness of arthroscopic surgery for arthritis of the knee. In this study, one group received a full arthroscopic debridement. They cleaned it all out. One group underwent arthroscopic lavage, or basically a bath in which they irrigated with fluid alone, drained it out, and sewed him back up. And the last group had 3 1-centimeter sham incisions placed around the knee, but no actual procedure was performed. Now, this study concluded that the arthroscopic surgeries done for advanced arthritis were no more effective than the sham operation. All 3 procedures produced relief at the same rate. Once again, are the results more real from the medically accepted procedure than for the 2 controls, the placebos? Based on what you know now, would you consider the 3 types of surgery to be sham procedures? Okay, one more example. In recent years, 2 studies were done to evaluate the intracranial implementation of fetal neural cells for Parkinson's disease. These studies had some of the study patients randomized to a sham operation that required simulating all aspects of the surgery, including the drilling of burr holes into the skull under anesthesia. There were positive findings with both procedures that were very similar. So again, the question is either procedure effective? Are both procedures effective? What does it mean for them to be effective? And which one, if any, would you call the placebo? Here's my answer to the question, or the accusation, of whether or not hypnotherapy is merely a placebo. Hypnosis, surgery, acupuncture, psychotherapy, and voodoo all have an element of the placebo effect. If each profession can remove the ego so that we keep our clients' or patients' best interests at heart, as opposed to pointing to one another and screaming placebo or sham or fake, we may be able to bring some relief to the suffering of this world. I don't hold the medical profession at fault for any of the sham procedures that they've performed over the years. They, for the most part, are truly committed to healing their patients. If it turns out that of all of the people that I have helped quit smoking, lose weight, get motivated, relieve stress and anxiety, pain, etc., if this was all done and the process turns out to be simply by the placebo effect, I can live with that. I know that the cigarettes that are no longer smoked are real. The pounds that really were lost are real. The quality of life that improved for my clients is real. That's what I'm here for. It's not about me. It's about you. Comment down below. I'd love to hear your thoughts. And please leave us ideas for other topics that you'd like us to address. Like us on Facebook at Facebook/MAXPHY, or find our website at maxphy.com or maximizeeq.com. You'll find those links below. Have a great day.